The 9 best foods to dissolve blood clots. When the proteins in the blood, called fibrin, cluster, and entangle, blood clots form. These clusters can block circulation and lead to serious health issues like heart attack, stroke, or pulmonary embolism. While blood clots are necessary to stop bleeding from an injury, unwanted clots in blood vessels can be very dangerous. So let's move on to the first food. Number 1. Papaya. Papaya is a tropical fruit that contains the enzyme papain, capable of preventing blood platelet aggregation. Studies indicate that papain inhibits platelet aggregation by suppressing calcium influx into platelets and interfering with fibrinogen binding activity. In addition to improving blood circulation, papain also aids in the digestion of dietary proteins. Enjoy fresh papaya cubes with lemon juice for breakfast or as a snack during the day to take advantage of its anticoagulant benefits. In second place, grapefruit. Grapefruit contains antioxidants like naringin and vitamin C, which prevent platelet aggregation. Naringin extends clotting time and inhibits fibrin polymerization, as well as reduces platelet activation. Vitamin C also reduces platelet aggregation by increasing nitric oxide levels. Studies also demonstrate that grapefruit can lower cholesterol levels, thus improving cardiovascular health and blood flow. Number 3. Turmeric. Turmeric contains a powerful compound called curcumin, which has strong anti-inflammatory and anticoagulant properties. Curcumin prevents platelet aggregation and reduces the risk of clot formation. It also stimulates nitric oxide production, allowing blood vessels to relax and remain open. Several studies have shown that curcumin can inhibit platelet aggregation by interfering with thromboxane A2 release, a compound that activates platelets and stimulates clotting. Additionally, curcumin reduces the overproduction of fibrin, a protein involved in clot formation. Turmeric is highly effective in combating unwanted blood clots by disrupting various pathways leading to clotting. Number 4. Ginger. Similar to turmeric, ginger contains anti-inflammatory compounds called gingerols. Studies suggest that ginger may have aspirin-like blood-thinning abilities, preventing platelet aggregation. Gingerols inhibit certain enzymes that generate inflammatory compounds activating platelets. They also improve fibrinolytic activity and prevent blood constituents from clumping together. Ginger also contains salicylate, which can help dissolve existing clots in blood vessels. Consume raw ginger in soups or smoothies, or enjoy ginger tea to benefit from these protective compounds. In fifth place, cinnamon. Cinnamon is rich in antioxidants, such as polyphenol, which improve blood flow and prevent clot formation. It also contains coumarin, which can mimic the action of anticoagulants. Studies show that cinnamon extracts can prevent platelet activation by hindering calcium mobilization in platelets and blocking thromboxane production. However, it's important to consume cinnamon in moderation, as excessive coumarin can be harmful. Number 6. Garlic. Garlic is rich in a compound called agene, which gives garlic its powerful anti-clotting abilities. Agene prevents blood platelets from becoming sticky and joining together to form clots. Studies have shown that agene inhibits platelet interaction with the blood vessel wall and fibrinogen binding, essential for clotting. Additionally, garlic reduces cholesterol levels and blood pressure, improving circulation. Let crushed garlic sit for 10 minutes before cooking to release clot-dissolving compounds. Number 7. Cayenne pepper. Cayenne pepper contains capsaicin, which gives it its red color and has blood-thinning properties. Capsaicin inhibits platelet aggregation to prevent clot formation and relaxes blood vessel walls, allowing for better blood flow and reduced blood pressure. Capsaicin interferes with platelet activation by blocking calcium signaling and thromboxane A2 release. It also increases circulation and fibrinolytic activity in the vascular system to dissolve clots. Use cayenne pepper in your meals or mix with lemon and warm water for a homemade blood-thinning tonic. Adjust the amount according to your tolerance to the beneficial components of capsaicin. Number 8. Vitamin E. Vitamin E, being fat-soluble and a powerful antioxidant, inhibits platelet aggregation by blocking the action of substances that stimulate clotting. Studies show that vitamin E supplementation increases nitric oxide production, which relaxes blood vessels and improves circulation. It also reduces thromboxane A2 release from platelets and interferes with fibrin formation. Foods rich in vitamin E include almonds, sunflower seeds, spinach, and broccoli. The recommended daily intake for adults is 15 milligrams, so consume a handful of nuts and seeds daily to meet your needs. And in ninth place, we have salmon. Salmon is rich in omega-3 fatty acids EPA and DHA, which have anticoagulant effects in the body. These fatty acids reduce fibrin production and platelet aggregation. EPA and DHA in salmon inhibit platelet activation by reducing thromboxane A2 generation in platelets. They also limit fibrinogen binding to platelet surface receptors, which is essential for clot formation.